My study topic is role of diffusion weighted magnetic resonance imaging and apparent diffusion coefficient value in carcinoma cervix and evaluate its response to chemoradiation. Primary author is myself, D. Vamsi Venkat. My corresponding author is ours, Dr. Anil Kumar Saklecha, Professor and HOD of Sri Devarajas Medical College in Karnataka, Department of Radiodiagnosis. Coming to introduction, carcinoma cervix remains the leading gynecological cancer worldwide and is the second most common cause of cancer-related deaths in women living in developing countries. DWI-MRI have a substantial clinical value as a reliable and early marker of treatment response. Early prediction of treatment response with the help of diffusion-weighted MRI could provide a window of opportunity to modify therapy if needed. Clinical prognostic factors alone have limitations in prediction of early response. The purpose of the study is to evaluate the efficacy of DWI and ADC value in carcinoma cervix and predicting response to its chemoradiation. Aims of study is to perform and assess DWI-MRI and ADC values in carcinoma cervix before and after chemoradiation. After chemoradiation, approximately around 5 to 6 weeks. And second objective is to evaluate the efficacy of DWI-MRI and ADC values in predicting response to chemoradiation. Inclusion criteria: patients diagnosed as a squamous cell carcinoma of cervix with stage 1B, 2 to 3B are taken. All patients who have undergone radiotherapy, chemotherapy, and brachytherapy are included. And the patients with Karnofsky performance status score of 80 to 90 are included. There is a chart showing a Karnofsky performance score. 100% is healthy, no symptoms or signs of disease. We will take patients with 80 to 90 score. Exclusion criteria: prior treatment for pelvic malignancies, patients with recurrence of carcinoma cervix, patients diagnosed as squamous cell carcinoma cervix with stage 1A, 1B1 and 4, and patients diagnosed as adenocarcinoma of cervix, and patients with any synchronous malignancies are excluded. Coming to methods, informed consent will be taken from all patients, and MRI pelvis is performed on 1.5 Tesla 18-channel MR scanner, Siemens Magnetom Avanto. The following sequence were acquired during MRI scan: T1 weighted imaging axial, T2 weighted in 3 planes, STIR in axial and sagittal, DWA and ADC in axial and sagittal, GRE sequence in axial and sagittal. Post-contrast T1 weighted fat saturated images are taken in all 3 planes, and patients will be staged according to FIGO staging. This is a prospective study spanning 18 months, and data was collected from 30 patients. The study includes patients who were diagnosed with carcinoma cervix and were referred for MRI pelvis. Data is collected from 30 patients diagnosed with carcinoma cervix who underwent MRI, from which DW and ADC values were obtained before undergoing chemoradiation therapy and 6 weeks after undergoing chemoradiation therapy. The images of the study will be reviewed in the Synapse workstation, and extraction of relevant features also done from a Synapse workstation, such as DW and ADC values. This is a case 1 pre-treatment MRI image. The first above image showing ADC map and corresponding DW image at B value of 50. We have taken ROA of pixel size of 5, showing mean ADC value of 0.79. In the same case, after 6 weeks post-chemo radiation with ROA of 5 pixel, the mean ADC value has increased to 1, showing a good response to chemoradiation. This case 2, in which ROA was of 5 pixel with mean ADC of 0.66. The same case after post-chemoradiation after 6 weeks with the same ROA shows mean ADC of 1.79, which shows increase in ADC value compared to pre-treatment, showing good response to chemoradiation. This case 3, ROA placed around the tumor site, showing mean ADC value of 0.7. In the same patient, post-treatment, the mean ADC value increased to 1.67, showing a good response to chemotherapy. Coming to results, this chart shows patient demographics. Out of 30 patients, 80% of patients falls under 51 to 60 and 61 to 70 years. Only 20% of patients falls under 71 to 80 years. Out of all cases, 77% showed T1 isointense signal intensity, 23% showed hypointense signal intensity. The all cases showed T1 and T1 plus contrast heterogeneous signal intensity. Among the cases, 73% showed a homogeneous restriction of diffusion and DWA, and 27% of cases showed patchy areas of restriction of diffusion, and 83% has hydroerythroid nephrosis, and 60% have enlarged lymph nodes, and 60% had a pyometra as other findings. This chart shows the stage of the disease histopathologically out of 30 patients. Out of 30 patients, stage 3C is the highest amount, least being 4A and 4B. The size of the lesion, pre-treatment and post-treatment, there was a little reduction in the size after post-chemo radiation. And this chart shows a pre-treatment and post-treatment ADC values. There is significant rise of ADC values above 1 in post-chemo radiation. Coming to results, in all 30 cases, there is mild decrease in size of the lesion following 6 weeks of chemo radiation, and all 30 cases shows increased ADC values after 6 weeks of chemo radiation. Discussion: the present study investigated the utility of DWI MRI and ADC values in carcinoma of cervix, particularly to monitor and predict response to chemo radiation. A key finding was a significant rise in tumor ADC values from the pre-treatment scan to the early treatment phase, and tumor ADCs increased markedly within the first few weeks of therapy compared to baseline, reflecting reduced cellularity as the tumor responded. This increase was statistically significant, indicating that even in the early phase of chemo radiation, cervical tumors undergoing effective treatment show measurable higher ADC values. These are my few references.